Training NEWS2 chart. Completing the demographic details on commencing the activity is probably best done as you are checking their ID when meeting them, along with the date and time of the reading. The chart is color-coded to help you recognize severe symptoms. Where a patient's NEWS score falls into the colored category, you can instantly recognize if a patient is in a potentially serious condition. Do in this order as per NEWS2 chart order, but you must do the pulse and respiratory rate together. Use a systematic approach to complete the observations. Taking the pulse and respiratory rate together in 2 minutes is necessary in the OSCE. Tell the patient you are checking for 2 minutes, but check respirations for a minute covertly. Detect radial pulse. Check for 60 seconds against your fob watch. Inform client it is in acceptable limits. Give client acceptable range. Mention it was regular and strong. The pulse is measured by firmly compressing the artery against arm tissue, counting the number of beats in a minute. The pulse is palpated to note the following: rate, rhythm, amplitude. When checking the patient's pulse, tell them you will take it for 2 minutes. Do not mention you will take the respiratory rate to the patient, as it may affect their breathing pattern. Take the pulse for a minute, then take the respirations for a minute, recording both measurements after the 2 minutes. There is a video tutorial. Respiratory rate. Watch the patient's chest rise and fall. One inspiration and exhalation is 1 cycle. Observe for abnormal breathing patterns and noises such as wheezes or crackles. Check their respiratory rate against the values on the right-hand side of the chart. SpO2. Saturations. Check which finger they would allow you to use. Verbalize if the nails are clean and have no nail varnish on. Assess for capillary refill, compressing the nail firmly for 5 seconds and releasing, noting the blood flow returns in less than 3 seconds. Apply the saturation probe to the finger. Leave the reading for 10 to 15 seconds to see if their saturations are stable, longer if they are variable. Check if in normal range against values on the right-hand side. SpO2 Scale 1. The NEWS chart has 2 scoring scales for recording oxygen saturations. For the vast majority of patients, Scale 1 should be used, with Scale 2 being used for patients with hypercapnia respiratory failure. There is a video tutorial. SpO2 Scale 2. This scale will not be used in the OSCE for a respiratory patient. Be mindful not to write in the error. As stated in the box, it is to be used only under the direction of a qualified clinician. Patients with COPD and hypercapnia respiratory failure will be on this scale. These advanced disease patients are unlikely to be used in the OSCE, and if they are, it is clearly stated. So it is best to put a line through this box when you start the charting. Air or oxygen. If the patient is on oxygen, check the flow rate. Write it on the chart in the box O2 L per minute, such as 15 L per minute. If they are wearing a face mask, it will be a non-rebreather mask. Write this in the device box NRB for non-rebreather. The flow will not be less than 10 L per minute if it is in a rebreather mask, as is currently used in the OSCE. Blood pressure taking. Ask the patient if the arm is okay to use, if they have not had lymphedema or are at risk. An venous fistula, trauma or surgery to the arm or axilla, brachial artery surgery, intravenous IV, infusion in progress. Check if tight or restrictive sleeves need removing first. Ensure patient arm is well supported at the heart level with the palm of the hand pointed upwards. Cuff size selected. Cuff bladder length should be 80% of the circumference of the upper arm and its width 40%. Brachial pulse palpated and center of bladder placed over it. Bottom edge of cuff placed 2 to 3 cm above antecubital fossa. Apply cuff firmly but not too tightly. Advise them you will not speak for a couple of minutes. Note that the machine is working and note the readings. Clothing replaced for client. Compare the blood pressure against what is normal on the scoring system on the chart. There is a video tutorial. Consciousness. The patient will be alert or they will not be confused. If they were, they do not need to be on a GCS chart and would score here 3. Ignore the last 3, V for voice, P pain, U unconscious, as the OSCE patient will not be only responding to voice pain or be unresponsive. Tympanic reading. Check if they are wearing a hearing aid and use the opposite ear. Walk around the bed rather than leaning across to take the reading and having the patient twist their neck. Cover end without contaminating it. Do not touch it when putting end on. Gently place tympanic probe in ear canal. Leave tympanic in ear for correct amount of time until it beeps. Remove the thermometer without the probe cover contaminating your hands. Read temperature. Discard probe cover mindful of infection control into the clinical waste bin. Inform patient or client of reading and that it is within acceptable range. Inform patient of normal ranges for temperature measurement and explain to the patient if over 38.0 Celsius. Advise them normal 36.0 to 38.0. Use Celsius, centigrade, old ward. There is a video tutorial. NEWS total. Add up all the scores as per scoring system and document them clearly. Monitoring frequency and escalation of care to doctor must be marked Y, yes, or N, no. You must write your initials clearly. Nurses are directly involved in the decision-making process for the treatment of patient, and it is vital that you must be able to think critically when assessing patient signs and identifying potential problems. Appropriate recommendations and actions should be made. It is a fact that doctors or specialists make the final treatment decisions, but nurses should be able to communicate information regarding patient health effectively. In the OSCE, this should be done to the examiner while keeping the patient informed of your plan and therefore gaining consent and allowing them a chance to ask questions. Chart 1. The new scoring system.